Hey everyone, by request, Dr. Mark Supernaut here, Family Healing Chiropractic. By request, I did a class this last week about neck, back pain, arthritis, and how to manage them effectively. And so I want to just give basically a 10-minute recap of what the class was for those of you that missed, so you can kind of get a good idea of how to be able to manage these things in your life and get some relief, but more importantly, find out what is the body really telling you when it comes to this stuff. So we went through a lot of stats here, and I always like to tell it from the standpoint is that my old diagnosis teacher at Palmer College of Chiropractic taught me a long time ago to think for myself. And so in this 10 minutes recap, I want to make sure that you are able to think for yourself, reason things, understand things. But the reality is that first, I want you to see what the problem is and then also what the solutions are. But some of you guys know this, but neck and back pain is it's the prevalence of this has gone up and up over the course of years. 30% of adults have these things. Arthritis, 1 in 4 people have arthritis, some sort of arthritis along the way. Um, Quality of life, obviously, these things, physical limitations, chronic pain sufferers. We had a lady that came through my office doors this last week that wasn't able to run a half marathon, which was her dream last year. This year, she was able to run it, just completely changing her life. Also, when people have chronic pain, it reduces life expectancy, but it also reduces quality of life, obviously, ability to be able to play with your kids, grandkids, obviously, along the way. Social costs, the cost of these things are massive. 40,000 deaths a year due to opioid overdose, people taking drugs to try to manage these things. And taking drugs never fixes the problem, it just covers up the symptoms along the way. There are economic costs for $560 billion in direct and indirect costs yearly to medical expenses, 42% higher healthcare costs with chronic pain patients than those that don't have pain. Basically, what pain's telling you is that you have sickness and disease going on inside your body. There is something going on. There is a problem inside your body. There is something wrong. Your body's trying to tell you something along the way. I use this slide to illustrate. I have a couple friends that wrote a book called Cruise Ship or Nursing Home, and really kind of challenged everybody that was at the class. And I'm challenging you if you're listening to this in this 10-minute video. If you're having aches and pains, your body's trying to tell you something. You have a choice to make. You can take responsibility for your health, for your life, and you get to choose. Are you going to have a health? Are you going to have a life where you are able to enjoy retirement? Or are you going to live in a nursing home and just sputter out through the rest of your days? So, what symptoms are trying to warn us? The symptoms are trying to tell us that there is a bigger problem, whether it's headaches, digestive problems, menstrual cycle issues, male issues, sciatic nerve, numbness and tingling, acid reflux, dizziness, fatigue, digestive issues, constipation, anxiety, depression, you name it. These things are your body trying to tell you that there's a bigger issue at hand. Just like these warning signals in your car are trying to tell you that there's a bigger issue, a bigger problem going on. And what's pretty fascinating to me is that when these things, my oldest daughter, actually my second daughter, my oldest daughter, Elle, had a flat tire recently, had the flat tire light on there, and nobody loves to see that stuff. But, she kind of wanted to put it off. And the reality is that she had a nail in her car about that big in her tire. And if she would have put it off long enough, that $20 fix it for that nail taking out of her tire and fixing that thing and repairing that cost a heck of a lot less time and less money. But the reality is, if she would have kept driving it and just ignoring these symptoms, these signals, it would have turned into, number one, it could have turned into a blown tire, which would have cost a lot more. It could have turned into a car wreck, which would have turned into a lot more. It could have turned into even fatality. And, we kind of take that lightly when it comes to our car, but we know better. And you should know better when it comes to your body, but you've been brainwashed. You've been programmed to think that symptoms are your problem. The neck pain's your problem. The back pain's your problem. The sciatic nerve problems. The headache's your problem. The high blood pressure's problem. These symptoms are not your problem. These symptoms are the signals of your body trying to tell you that something's wrong. And so instead of thinking like a symptom, think of it like a function chart. So you can see this on the function chart here, that you have 0% and you have 100%. And so the reality is that as your body is functioning at 0%, you are dead. If your body's functioning at 0% function, you're dead. But if your body's functioning at 100% function, that means that you're alive. That means your body's healing, it's adapting, it's doing what it's supposed to do. It's able to adapt to stresses and strains and things that happen in our life. Our body's able to overcome symptoms when that happens. But the reality is that as you start to lose function, as you start to go from 100% down to 0%, along the way, symptoms don't show up until you hit 60% function. So what happens is the body, as it goes towards 60% function, that's finally when the symptom shows up. Just like your oil light doesn't show up when you lose 1 ounce of oil. Just like your tire light doesn't come on if you lose 1 PSI. It comes on when you lose a significant amount. Same thing with symptoms in your body. It doesn't happen until you lose a significant amount of function. That's finally when a symptom shows up. So when you have the symptoms, why does the body create the symptoms? It's because you have this overload of stressors in your life. I'm not going to go through this in depth because I did this at the class. If you want to know more, ask me, but you have stresses. And stresses in your life come in the form of thoughts, emotional stress, traumas, physical stresses, or toxins and chemical stress. We're all exposed to these, and different people can handle different amounts of these things. But if your body becomes overloaded with this, then the body has to do something with that stress. And the major way that the body, if it can adapt to the stressors or the levels of the stressors, the nerve system from inside the body has to do something about it, and it creates this what's called a short circuit or a subluxation process within inside your spine and your nerve system. And that subluxation process is that your body's no longer able to adapt to all these stressors going on. Your body has to do something with it. So the spine starts to move out of its normal position because it's trying to adapt to the stressors. And essentially, it's kind of like my daughters. I talked about this in the class. If my daughters all plug their curling irons, straightening irons, all in the same socket, it's going to blow the circuit. Is that desirable? Well, it's not desirable for them that's trying to dry their hair and straighten their hair. But if that circuit does not blow, then what's going to end up happening is there is going to be a greater problem that the whole house is going to burn down, and then none of the sockets, none of the outlets are going to actually work. And so the same thing with the body's doing this to protect itself. When the spine goes out of alignment, when stress is overwhelming to the body, the spine has to do something just to eliminate that stress, or to help with that stress, or adapt to the over amounts of stress you have. Just like if you put enough stress on a bone, it's going to break. It has a breaking point. The spine, the nerve system, has a point to where it has to do something about all the stress that's coming in. And that's what subluxation is. Subluxation of the spine is when the spine starts to move out of its normal alignment. Now you've created this stress to the spine, and there's nerves that go through here. The nerves, you can see the normal nerve, the spinal cord at the top picture here. The bottom one is when the nerve roots become impinged, or the effects of the nerves don't work the way it's supposed to. Think of it like tone. If you have a guitar string, I have a guitar over here, and if I grab the guitar, if I pluck the string and it's tuned and makes a perfect sound, but if it's too tight or too loose, it makes an awful noise. The same thing happens with your spine. When there's too much pressure, too little, too much pressure, it disrupts the tone of the communication pathways of your brain to your body. And when that tone's off, then wherever the nerves go to starts to create effects within inside the body. And so what happens is, you can see the nerve system here, that nerve system at different levels, the nerves go to different things. And depending on where the stress is adapting, where that subluxation process is, if the nerves that are going to your ears, eyes, nose, and throat are causing an issue, then the nerves are going to be affected there, and it can cause things like headaches or dizziness or allergies or head colds, runny nose, sinus problems, you name it, and go all the way down through this list. So that stress, that subluxation, that neck pain, that back pain, that arthritis is trying to warn you about the long-term effects of stress to this nerve system, and it's showing up as symptoms. And see, the reality is you've got 3 options when it comes down to this. The 3 options are: you could do nothing about the symptoms, and whatever's causing it's going to keep getting worse. Number 2, you can go medicate it. You can even get massage. You can get physical therapy. You can even go to a chiropractor's office and get some some adjustments just to help with the symptoms or have them rub on your muscles. But the only way, the third option is to find out why is it there, where's it at, remove the subluxation, allow your brain to start to communicate down through the body, and let your body go through its own healing and function. It restores function to your body. And we've seen people heal from neck pain, back pain. I've seen people heal from arthritis in our office. I've seen people heal from depression, anxiety, cancers, heart disease, diabetes. I've seen it all. And the reality is that I didn't heal anything. The body is able to heal from anything and everything, but you have to restore the function between the brain and the body and the brain. That's the only way that your body can truly heal from the inside, which is what we're looking for. I'll talk about this briefly, but I wish you'd have been at the class because I went over this in depth. It's called the Windsor autopsies. Back in 1921, there's a Dr. Henry Windsor. He was a medical doctor in Pennsylvania. He asked the question, chiropractors claim that by adjusting one vertebra, they can relieve stomach troubles, ulcers. By adjusting another, they can help menstrual cramps. By adjusting other conditions such as kidney disease, constipation, heart disease. He's like, but how does this even work? So he did research study on this, and he went to cadavers that if they died of kidney problems, heart problems, lung problems, whatever it is, he went in the cadaver and he traced the organ and traced the nerve back to the spine to see if there was stress and pressure on it. And what he found is that out of 221 disease structures, he found that 212 of them had direct correlation between the brain and spinal cord. Essentially what he said is, he says, oh my gosh, this is over 100 years ago. Chiropractors were correct that if you have damage to a nerve that's going to an organ, that organ can't function, can't heal, can't do what it's supposed to do. And so in chiropractic, what we want to do is a broken safety pin is when it's open and the communication is not there. And when we give you an adjustment, we want to reclose that safety pin to make sure that the brain's communicating with the body and the body's communicating with the brain. Like I said, you have three choices. You can do nothing, it's going to get worse. If you have symptoms, do nothing, it's going to get worse. Go to the doctor. Number two, you can go to the doctor, medicate it, massage it, ice it, get some adjustments on it intermittently, and it's going to hide the symptoms but not fix the cause. Third option is find out what's actually causing the issues. That's what we get a chance to do when we come to the office. So how do you eliminate stress? How do you decrease the fact that you have stress coming in your body? Eat clean food. Find a way to find peace in your life and your mind. In some people's cases, it's religion, it's spiritual, it's Jesus. And so you got to find that peace in your life. Minimize your toxins and detox. You've got to move and exercise your body. And of course, your brain and spinal cord has to be in perfect alignment. If you have more questions about this, if you're watching this, if you have more questions, feel free to email us. Feel free to call us. Go to our website. All that stuff is right here. My email's here. My phone number, that's my personal cell phone number. If you have questions, feel free to reach out to me. Love to see if I can help you out in any single possible way. Hopefully this is a good recap for you guys. Send this on to friends. I challenge you guys. And also, if you want us to come out and speak at your church, your business, your school, teachers, whatever it is, we would love to come out and get a chance to help the people that are around you in your life as well.